Why do antibiotics fail for some H. pylori ulcer treatments? Imagine trying to clear out a stubborn stain that just keeps coming back. That's similar to what happens when antibiotics don't fully get rid of Helicobacter pylori bacteria. These bacteria are tricky because they can develop ways to resist antibiotics, making treatment more challenging. One main reason is genetic mutations. The bacteria can change their DNA in specific areas, like in the 23S ribosomal RNA gene, which makes antibiotics like clarithromycin less effective. Other mutations in genes such as GIRA can lead to resistance against fluoroquinolones, and changes in RDXA and FRXA genes can cause resistance to metronidazole. These genetic tweaks alter the bacteria's targets or how they process drugs, so the antibiotics can't do their job properly. Another trick H. pylori uses is forming biofilms. Think of biofilms as a protective shield or a fortress built by bacteria. These biofilms are made of a slimy matrix that encases the bacteria, preventing antibiotics from reaching and killing them. This makes eradication much harder. The bacteria also employ efflux pumps, tiny molecular machines that actively pump antibiotics out of their cells. This reduces the amount of drug inside the bacteria, decreasing its effectiveness. But resistance isn't just about the bacteria. Sometimes, treatment fails because doctors don't test for resistance before starting therapy. Without knowing if the bacteria are resistant, the chosen antibiotics might not work. Patient factors also play a role. If someone doesn't finish their full course of medication or experiences side effects that cause them to stop early, the bacteria aren't fully eradicated and can develop resistance. Overusing antibiotics in general, whether for other infections or misuse, also promotes the growth of resistant strains. All these factors often work together, creating multi-drug resistant H. pylori strains that are much harder to eliminate. To improve success rates, healthcare providers may use combination therapies that include multiple antibiotics along with medicines that reduce stomach acid. They might also use newer drugs with better activity against resistant bacteria or perform molecular testing to identify resistance mutations. Monitoring local resistance patterns is essential to choose the most effective treatment options. In summary, antibiotics fail in some H. pylori treatments because the bacteria have evolved multiple resistance strategies, mutations, biofilm formation, and efflux pumps that make antibiotics less effective. Addressing these challenges involves understanding resistance mechanisms, conducting susceptibility testing when possible, and following updated treatment guidelines. Always remember to consult your healthcare provider for personalized advice, as each case can be different.